Welcome back. Now, the majority of South Africans depend on the public healthcare system, and over the past few years, it has faced many challenges, and one of them recently being funding cuts from the US, leaving thousands of citizens vulnerable. The need for private sector intervention has never been more urgent, considering the role it can play in bridging South Africa's health funding gap. Palesa Mokomele, Head of Community Engagement and Communications at DKMS Africa, joins us now. Thank you so much for your time, Palesa. Of course, we are fresh off the proposed budget by the Finance Minister, Enoch Godongwana. Of course, whether it will be approved is a conversation for another day. But just looking at the allocations that the minister has made, particularly for health, 28.9 billion added to the health budget. Does it go deep enough to actually create a sustainable healthcare landscape in the public arena?
I think, thank you so much for having me, but I think that it's going to take a couple of years for us to see major shifts within our healthcare system. Just as an organization that works within the stem cell transplantation arena, it costs between 1 million and 1.5 million for a transplant in this very, very highly specialized field. And therefore, if you look at the allocation to healthcare, compared to the increase in VAT, the man on the streets is facing a really difficult journey, particularly when they are faced with life-threatening illnesses such as cancer that need prolonged care and that basically need an environment that not only supports them clinically, but in other psychosocial avenues in their lives as well.
Yeah, it's also quite interesting because, I mean, you need a number of things for the ecosystem of health to work, including infrastructure, but also employment. And I actually want to go into that employment aspect of it because there was an article out that only 800 doctors out of the 1.5, 1.8 unemployed doctors will actually be helped by the allocation into healthcare. And actually, how can the private sector actually looking at absorbing this kind of graduates that seem to be outpacing the absorption in the public arena?
In our field, which is hematology, we have a shortage of specialists, not only in terms of doctors, but in terms of nurses who specialize in taking care of this very precarious transplant process, right? So we have major shortages when it comes to this. What DKMS has done is to start, we're in the beginning phases of trying to develop a curriculum which will, with the public and private sectors, get more nurses specializing in stem cell transplantation. Because if the state if the state is spending money on transplants, and we know, I mean, we're talking about shortages in healthcare. If you spend so much money and a patient loses their life because of an infection, then, I mean, that's a huge problem because all these funds, all these resources have gone into the specialist, into the specialized process. So there are many degrees to which we need development in healthcare. I think we are unfortunately in a state where we're trying to build a ship while it is going. Yes. And I think that in order for us to almost be careful about how we build this ship, we need to take almost not a step back, but we need to be reflective really about what it is that we want to do. Everything is a priority, but really we can't do everything at the same time. We're just happy that that the budget has increased, but we need more than just the state to take on this very difficult path towards stabilizing healthcare for the benefit of our citizens and as an investment in our country as well.
And I mean, everybody needs to come to the party. Is it also a case of maybe we have not gotten to an ideal model of public and private partnership in the healthcare space?
Absolutely. And the issue of the NHI came up as well in the speech. The minister jokingly said that he hasn't received a blueprint on how the NHI is going to work. That on its own is also facing its own litigation. I'm not sure whether this is one of those cases where someone kind of pushes ahead and it happens, but without the buy-in of everybody else. I'm not a specialist in that.
Yes, yeah.
But I think for the sake of our patients and the sake of just giving people the minimum required healthcare, depending on where you are in the country, you're not getting the same kind of healthcare. We have so many people falling through the cracks, especially within cancer care, where basic medications are not found in all public facilities, and where even private facilities are perhaps too expensive for, the state in which we find ourselves economically. So there has to be middle ground in that sense. You don't want to sound too idealistic, but we do need to find middle ground. We have such a young population, and that's an amazing thing. But if you have a young, sick population, what's so great about that? So we all really need. We are a nonprofit organization. We've identified what we need to do. We are trying to give as many patients as possible a fighting chance against blood cancer. And we've invested about 60 million rands into the healthcare space in South Africa, really driving education and awareness. Because if people also are not diagnosed early enough, then the cancer care becomes more expensive. So you really do need more role players. We need more role players, but it needs to be done in a systematic fashion. Perhaps I know there's some initiatives that the Department of Health has started in terms of talking more about non-communicable illnesses outside of the most prevalent cancers. We are working in hematology, which is probably more niche, but we're doing what we can in this space, but we need more private sector involvement.
All right. Well, thank you so much for your time. We do have to wrap up the conversation there, Palesa. Thank you for your insights on how the private healthcare sector can step in, to basically build a more equitable healthcare landscape in South Africa. That was Palesa Mokomele, Head of Community Engagement and Communications at DKMS Africa.